Hi, I'm Dr. David Jerkins. I'm one of the plastic surgeons here in Cedar Rapids, Iowa. I work out of PCI Physicians Clinic of Iowa, and I'm here for a quick interview.
Take us through your academic background, please.
Sure. So, grew up in Louisiana, so did public school all the way through, and then I went to college in Houston at Rice University, did biomedical engineering for my graduate, and then I went into medicine right after. I did University of Texas at Houston Medical School, and then transitioned from there to an integrated plastic surgery residency in Ohio, and after that I came here to Iowa.
Wow, that's good. And tell us the years, because there's a child who's in school and wants to follow your footpath.
Sure.
So I'd love to know how long it took you at each and every stage.
So it's roughly 14 years after high school. So it's 4 years of college, 4 years of medical school, 6 years of residency. There are some places where you can do 6 years of college and med school combined, and it kind of foreshortens everything for you. But those are harder to find and get into. And then residencies alter. 6 is kind of the shortest plastic surgery residency. You can do some longer ones if you do a fellowship and that kind of stuff.
Wow. Did you had any family support, or you were just an intelligent child and you got opportunities to get to where you?
Yeah, so my parents always supported me the whole way through. They were always there to help. But in terms of was there any other doctors in the family? No. We had a phlebotomist. That's the closest thing to medicine we had in the family.
Wow, that's wonderful. What is the most life-changing surgery you have ever had done?
Oh, that's a good question. It kind of depends on the patient. Every patient thinks something is more or less life-changing. Most of the things I would say are probably traumatic or chronic wound limb salvage. So we're saving someone's leg, keeping some kind of functional joint so they can use it. Mm-hmm. So rearranging a foot to become a knee, or bringing bone from the leg up to the back to stabilize the spine, that kind of thing. I would say those are probably the biggest ones.
Wow. Have you ever had any patient who cried after seeing your results?
Yeah, a lot of people who have been self-conscious with how they look or feel for years, on that first kind of reveal where they see it in the office, they're overwhelmed sometimes, and so they often will tear up a little bit.
Wow. Okay, and what surgery tends to give the biggest confidence boost?
Happiest would be breast reductions. I would say they're statistically the happiest procedures we do. In terms of biggest confidence boost, probably breast augmentation or tummy tuck is a confidence boost, and I lump breast reconstruction for cancer into augmentation, where we're just improving the overall cosmetic appearance of the chest.
Mm-hmm. So can you please tell us a little bit about the tummy tuck? I think most of us women, we are so interested in this tummy tuck, but we are scared. We don't know what to expect and what not to expect.
Sure. So a tummy tuck is a very big procedure. It takes many hours to do it, and it involves a lot of scarring. So there's always going to be a scar at the bottom of the belly. And depending on the type of tummy tuck, from a mini to a full to a what we call a fleur-de-lis, you can have a scar around the belly button or a full scar vertically down the belly as well. It kind of depends on what your abdomen would look like. And you just kind of consult with your plastic surgeon about the best option for the best cosmetic outcome for you. What it does is it repositions that skin, and so it gets rid of all of the excess skin that oftentimes comes from kids and pregnancy or weight loss, and then it just pulls it down, and then we can also repair the muscles that get kicked apart when you have kids. And so the diastasis of the rectus muscles is often a very big part after children because of how severe it can be in some patients. And then you can add a little bit of liposuction just to kind of improve flank contour as well.
Wow. So how long do you start seeing results if you have a tummy tuck after the surgery?
The results are immediate, but you're not fully healed until about 3 months out. You will still have a little bit of lingering of the swelling for quite a while. But it's pretty drastic anyway, just at the first office visit. Now, staying bent over for 2 weeks is very important. So that's one of those things. There are restrictions and recovery protocols that you do have to follow to get the best recovery, though.
Wow. And then, do you think that some influencers are promoting realistic expectations on social media?
I mean, the influencers do what influencers do. I mean, they'll Photoshop things, they'll put filters on, they'll lie about the dates, or they'll omit the dates of surgery. And, you'll see this person, they'll have a 6-month post-op photo and they'll tell you it's 6 weeks out from surgery. And so people think that they should have no swelling already. And so they give varying degrees of truth. You just got to be careful and get as many sources as you can.
Uh-huh. And then talking about surgeons, how can people spot a fake or unqualified surgeon?
Typically, if you're looking to do any kind of reconstruction or cosmetic surgery, you want to make sure that they are a board certified surgeon with the plastic surgery. So American Board of Plastic Surgery has a very rigorous protocol for approving. There's a written board, an oral board, and then every year you're doing maintenance of certification that you have to do on top of that. And then every 3 years you have to do a quality improvement for your practice in addition to that. So it just brings the practice standards and safety up to a higher level. Now, does that mean every plastic surgeon out there is great? No. So I would ask your friends that work in medical fields who they would recommend. They generally have the best insider knowledge.
Oh, nice. Okay. And what surgeries are surprisingly affordable?
I guess that depends on your budget, on what you're trying to do. Like a mini tummy tuck doesn't cost as much as a lot of people think. And what you'll see online a lot of times are the big city prices, right? In Cedar Rapids, Iowa, we're not charging, the 14 grand for the surgeon fee for the breast augmentation that they do in big cities like Miami and New York and that kind of stuff. So I would just go in and get a consult. We always offer a free cosmetic consult so that you can come in, learn the prices, learn what the restrictions and recovery are, and at least get a realistic expectation of what to see.
Okay. Okay, and what are the biggest risks people don't know about having surgery?
I mean, it's real surgery, right? So it's incisions, it's bleeding, it's infection. It is often full general anesthetic. So there's a lot of things that go into it that people, when they think of cosmetic surgery, they think of the Instagram reel where they see the beginning, the before, the during, and then the after, and it's all one, and they look like they never had any pain and never had any swelling or recovery or any of that. And I think it just makes it seem like it's not a real major surgery, and they often are. So just know that you do have to be healthy. It will take you a while to recover. Your energy will be down, and you got to follow the restrictions to make sure that the recovery is the best possible.
Okay. And how long does it take you to prepare for just a surgery? I hear you're saying these are big surgeries. How long does it take you to prepare for a surgery?
I mean, most people, when they come in for a surgery, are usually ready unless they have other health issues, heart, diabetes, lung problems, that kind of stuff. If they have those, then we need to optimize them, because this is what we call elective surgery for most of what we do. And so we want you in the best state of health possible. Other things to think about is any skin reduction surgery, breast reductions, breast lifts, tummy tucks, lower body lifts, thigh lifts, arm lifts. All of these, we want you basically at your goal weight where you're planning on staying, because we can tighten you as much as we can at your current weight. But then if you lose more weight, you will have more redundant skin, so more hang of your skin that you otherwise wouldn't have had if you just waited until you reached your goal weight before the surgery.
Yeah, this is so eye-opening. And then, do you ever say no to a patient who wants a procedure?
Probably once a week.
Once a week?
More. Yeah, I mean, there's a lot of people that will say, I want this little thing fixed or that little thing fixed. And what they see online, right, they don't see the scars. So fixing those things is usually possible. It's not always reasonable to do, though. A lot of the times you're like, that's a very minor cosmetic issue and I'm going to put a very big scar and cost you a lot of money to do it. I don't think it's time, right? Come back in 5 to 10 years if it's worse, or lose some more weight, or maybe just do spa therapy, right? So med spas have a lot of things they can offer that can get improvement in the minor details that aren't going to be requiring surgery.
Wow. And how do you know someone is doing surgery for the right reasons?
Gestalt. I mean, we've seen thousands of patients, and it's just talking to them and asking the right questions and kind of using your gut feel.
Wow, that's great. And what are the procedures that are trending in 2025?
Weight loss surgeries. So with all of the GLP-1s causing the big weight loss, a lot of people are coming in for tummy tucks, arm lifts, breast lifts, face lifts even, and neck lifts are also starting to become big.
Wow. And is the BBL trend going up or down?
Seen less of it, so it's probably going down. I haven't seen any studies on nationwide data, but from what I've seen, it's decreased some.
Okay, and what do you think is replacing it?
Probably just the skin reduction surgery, because everybody's losing so much weight. Their desire for a larger buttock is being shifted to, I need to get rid of the skin, as opposed to worrying about that.
Okay. And then, do people ever bring celebrity photos to you?
Yeah, absolutely. I mean, sometimes they're celebrities, sometimes they're friends, but we call them inspo pics or inspiration pics, so that we can see what the patient is really trying to achieve. They're actually quite helpful in the appointments. Now, sometimes people come in with unrealistic goals and you have to explain, right? You're not going to be able to look like Jennifer Aniston if you don't before. Minor changes are always possible with surgery, but drastic, not yourself transformations are usually not realistic.
Wow. And then, are men coming in for surgery? Do they ever even come in for surgery at all?
Yeah, every year we see more and more men coming in for cosmetic surgery.
Wow.
So it's becoming more and more commonplace.
Wow. And what procedures do men secretly love? We're curious.
In terms of on themselves or on other people?
On themselves.
Yeah, so again, a lot of it's weight loss, so a lot of them are actually doing tummy tucks. Men tend to want less contouring. They don't need the muscle repair that women, because they didn't carry the child, so their muscles are usually in better shape. But the tummy tuck has gotten pretty big, and then skin reduction for the chest is also a big thing.
Ooh, okay. And then I think you already highlighted how long a recovery takes, not the social media one. And do those scars, do they ever truly disappear?
No, scars will never disappear. Now, you can make them hard to see, right? Certain placements of scars and abilities to heal and scar therapy after surgery can make it very hard to see, but a scar is a lifelong thing. It will be there forever.
Wow. And then what's the biggest mistake people make during healing?
Big one is this trend for people to do lymphatic massage, and for some reason online people are telling them to start, week 1 or 2, which is the best way to get a seroma or a big fluid cavity that you don't want after a surgery. So before you do anything you find online, always ask your surgeon before you do it. And that includes switching compression garments or bras, or doing massages, or taking different medications that are supposed to heal you faster, or anything like that. All of these things can have problems within them, and you just want to double check with your surgeon.
Okay. And then back to you. What motivates you as a plastic surgeon?
Really just the patients. I mean, I love the surgery, right? I was an engineer in college, so I really like fixing things and seeing how they fit and constructing or reconstructing various parts of the body. But, coming in, talking to the patients, making them happier, making them more comfortable in their own body is very important to me.
And, someone who wants to be in your profession is probably curious. How many surgeries maybe per week or per day?
Plastic surgery usually has longer surgery times. So in a week, we'll probably do 10. Maybe if there are a lot of smaller ones, 15 at the most. But some weeks, you do one surgery for the whole day. And so you do 3 surgeries. but you're operating the whole day. So it just kind of depends on what surgeries you come across.
Okay, all right. And what's the most memorable moment in your career?
Ooh.
Or memorable moments?
I would say my most memorable moment was a medical mission trip we took to the northern region of Argentina called the Chaco region. And we had just a group of plastic surgeons, anesthesiologists, and an orthopedic surgeon go down. And we just performed surgeries for 5 straight days in one of their kind of local hospitals. And it was great. So within the 2 ORs that we had available to us, 2, I think it was 2, it might have been 3, but I operated only out of one of them. But combined, we did 185 surgeries in 5 days.
Wow.
So very busy, but everyone there was very thankful because it's care they couldn't otherwise get. And it was great to see the help and the care that patients needed to get.
And then another physician could be listening right now,
Okay.
and they are interested. Probably they are plastic surgeons and they would love to have a procedure or 2 with you. Is it something that you consider?
You mean like come in and shadow me or something
Yes.
like that? Oh, yeah. I mean, we got to make sure it's okay with the patient as well, right? Because you're bringing someone else not involved directly in their care.
Okay.
But education is always good to share.
Oh, yes. If someone only had $1,000 to spend, is there any cosmetic improvement they can get?
Yeah, but you generally won't be able to do it with anesthesia, and you might want to try and do it in the office, depending on what it is, just because it's very difficult to pay a facility fee at one of the surgery center, one of the hospitals, and pay anesthesia and pay the surgeon and be able to do it within $1,000.
Okay. And what is a plastic surgery trend you wish would disappear from social media?
Oh, that's a very good question. I am not sure.
Okay.
I mean, there's a lot of things. I would, at this point, the most annoying one to me is the lymphatic massage early on. That's probably my most annoying right now.
Okay.
But generally, it's gotten better. Now, if you'd asked me 5 to 10 years ago, I would say just the complete lack of realistic photos that people keep posting and saying. But it's actually gotten better lately.
Yeah.
I don't know if people have gotten better at scrutinizing it and so it's straightened up a little bit, or if whatever I'm seeing is just not as bad as I used to see. I don't know, but it seems to have gotten a little better.
Okay. And then would also like to know Dr. Jenkins outside the hospital setup.
Yeah.
Do you have hobbies?
I do, but I have a 5-year-old right now, so I pretty much spend every waking moment out of here with him. And then by the time I get him into bed, I'm very tired, so I usually end up in bed myself. But I do try and play soccer once a week on Sunday, which is always good. My wife usually plays with me. And then if I can find a little moment, I will read or play a video game as my release.
Wow. No, this is really good.
Sure.
Thank you so much, Dr.
Absolutely.
Jenkins. It's been a pleasure doing this interview with you.
Well, thank you. It was nice to talk to you.
And I hope you'll be willing to sit down with us when our viewers ask more questions. You know, plastic surgery is the in thing these days. But thank you so much.
You're very welcome. Y'all have a great day.
Thank you.
Bye, guys.